Welcome to our 21st Open Mic webinar. Here's a recap of what I presented for a member of our leadership team. This week, I'm substituting for Dr. Van Nguyen, who is chairman of the medical and scientific committee of our fund. And here's a recap of what I presented to a member of our leadership team. First part of my presentation, I focused on the underlying science and medicine of ovarian cancer. I then went over the statistic of ovarian cancer, which is quite staggering. Now, before we dive into the latest innovation, latest trend and outlook for ovarian cancer space, let's just go over the pathophysiology or the science and the underlying science and medicine of ovarian cancer. As you can see from the underlying structure here, ovaries connecting to the fallopian tube on both sides right here, and ovary, that's where they house like the woman egg. So what exactly is ovarian cancer? Ovarian cancer is when there's malignant growth form that is originating from the ovaries. There are different types of ovarian cancer. You have the epithelial tumor, you have the germ cell tumor, and also stromal tumor. Epithelial tumor, that's the most common form. The statistic for ovarian cancer is very staggering. Ovarian cancer is the number 8 most common cancer among women in the world, and it's also the number 8 cause of death for women worldwide. On a global scale, there are 324,000 women who are diagnosed with ovarian cancer each year. And the death rate for that is very, very high because 207,000 women die each year from ovarian cancer. Ovarian cancer is a deadly cancer because the 5-year survival rate is quite low compared to breast cancer. 5-year survival rate, that is the time as first diagnosis, and then 5 years of follow after. For women afflicted by ovarian cancer, the survival rate for that 5 years is only ranging from 36 to 46%, but it's compared that to breast cancer, which is very high in the 90%. Now, the statistic for women in the US is that 20,000 women in the USA each year is diagnosed with ovarian cancer. The thing with ovarian cancer is that it can go undetected for years. For ovarian cancer, it is classified into different stages like other cancer, which stage 1 where you have the cancer localized to the ovary. It has not spread to other area yet. Then from stage 2 to stage 4, that's when this cancer is starting to spread to elsewhere in the body. Now, the various stage from 2 to 4, depending on how far or how distant that the cancer spread, with stage 4 being widespread to distant area like the lungs or the brain. So symptoms, as I alluded, is just very vague, and it includes abdominal pain, pelvic pain, also urinary urgency. In the advanced stage, then there's changes in bowel movement or bowel habit. The women would start to have fluid collection in the pelvic area, also pain with intercourse, but of course there are other conditions with those symptoms like frequent urination, pelvic pain. There's just many other disease, other conditions that has those signs and symptoms. So that's why it's very difficult to detect ovarian cancer early on. Risk factor for ovarian cancer include family history, genetic mutation, age, and also reproductive history. Some of the factor that is protective against ovarian cancer. In other words, this is the factor that protect the women from ovarian cancer, and that is pregnancy, breastfeeding, use of oral contraceptive. And conversely, here are the risks that cause or that is associated with the increased risk for ovarian cancer. For example, if someone in your family has ovarian cancer, that also increases your risk. So family history, genetic mutation in the BRCA gene, BRCA1 and 2 is associated with increased risk for ovarian cancer, but also for breast cancer and other cancer as well. Postmenopausal also increased risk of ovarian cancer. After 40 years of age, then the women started to have increased risk of ovarian cancer. The next part of my presentation, I went over the current diagnosis and treatment, the current standard of care. Diagnosis first is physical diagnosis, and that's with the pelvic exam. And then after that, there's follow-up lab tests, and for the lab, we order CA-125. Aside from various lab, we also order ultrasound as well as CT scan to have an imaging of the tumor. Treatment, mainstay treatment is surgery and also chemotherapy, which is the conventional treatment for ovarian cancer. As you can appreciate, which I'll go over later on, is the latest advancement where you started to have targeted immunotherapy, which is a big advancement for innovation in this space. So for targeted drug conjugate for ovarian cancer, this conjugate drug system, you basically attach a payload to either a small molecule, like a small peptide, polymer, and also antibody. In this figure here, antibody drug conjugate, that's the best, in my opinion, the best one in the group, because antibody is very, very specific. Its bonding has great specificity. That is to say, it binds to the exact target that you designed it to bond to. And then when you attach a drug to an antibody, it's just like a smart missile, so to speak, or a smart bomb. It goes specifically to the target and then offload the payload to kill the cancer rather than killing other cells in the human body indiscriminately. Next part of the presentation, I share with our member on latest advancement in ovarian cancer treatment space. Here, I feature the latest drug that has been FDA approved, and that is mirvetuximab or Elahere. Along the line of antibody drug conjugate, as you can appreciate in the recent year, mirvetuximab is recently FDA approved for patients afflicted by resistant ovarian cancer that has high FRA or folate receptor alpha expression. And this drug is made by the company called Immunogen, IMGN, that is its stock ticker. This is the company that I've been recommending for our members for years, and also recently bought for our fund. And a couple of months ago, the stock was bought out to give us a sizable profit. But this story is very unique because Immunogen, years ago, they went to the FDA. They did not receive FDA approval. Instead, the FDA issued a CRL or complete response letter, as you know. As such, the stock took a nosedive by 80%. But when I read up on their data, their phase 3 data, I noticed that the subpopulation respond very, very favorably to mirvetuximab or Elahere, and that is the patient with the high FRA expression. So the company redo the trial, but instead of doing study on all the women who are afflicted by ovarian cancer, they just do the study on the subpopulation or patients specifically with high FRA expression. By leveraging on this precision medicine, I forecasted that the phase 3 trial would, the phase 3 Soraya and Mirasol trial would post positive data, and sure it did. As such, the stock increased multiple fold from the time from their low point at the TRL to the point when mirvetuximab posted the positive phase 3 data, and then after FDA approval, the drug generated significant sales. Within its first year, it's delivered, now this is on top of my head, roughly $250 million in sales for the fourth quarter or in the first year. And as such, the company will acquire, because this drug, based on its robust sales ramp up, is most likely going to become a blockbuster. It's basically an antibody that is attached to a payload. Now, this payload, it inhibits the tubulin protein, and tubulin protein is very important for cellular structure to migration during the cell division. By inhibiting the cell's division, the cells stop the cell cycle and cause the cancer cell to die. Next part of the presentation, I share information on the latest development for ovarian cancer treatment space by featuring interferon E as well as other treatment modality. Interferon E is just a very interesting new development, because as you can imagine, some patient, even if they drink, they smoke, but they just don't get cancer, where another patient who live a very, very clean lifestyle, never drink, never smoke, but they still get cancer. And in my opinion, interferon E might be one of the contributing factors, because it's found to be a tumor suppressant. In other words, it suppresses the development of ovarian cancer. So the question we ask for innovation is whether replacing interferon E or injecting IFN E into the patient, whether or not that would lead to suppression or reducing the risk of developing ovarian cancer, whether or not that would treat the cancer itself. So that is ongoing development, and I look forward to see more development, more news on that front. For last part of our presentation, I provided a recap of the current treatment and current landscape of ovarian cancer. All in all, ovarian cancer is quite a more prevalent cancer than what you think. 1 in 75 women worldwide will be diagnosed with ovarian cancer in their lifetime, and the average age of diagnosis is 63. This is the number 8 leading cause of death in women worldwide. There are traditionally, you have the surgery, chemotherapy. On top of that, now that you are having new or the novel immunotherapy like Elahere, IFN is in development. You also have like the PARP inhibitor, recently FDA approved as well, or the novel immune checkpoint inhibitor also. And this space is currently ongoing. The demand for novel treatment in this space is very robust. So in picking out stock that would, or young biotech company that are developing solution to this, I would look for something antibody drug conjugate for Immunogen, for example. That's a great investment, work out very well for us. If there are other companies that are developing simpler drug, then then I will take into consideration those companies as well. Also companies that are developing innovative diagnostic that I believe has a very high demand for that as well. All in all, I expect this space will continue to have more innovation, and I'll keep my eyes on this space to pick out a young innovative company that has novel different solution that can serve the demand for this treatment space. With all of that mentioned, I now open the floor to all of our members for your comment as well as question. If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen, he's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine-tune my research position and invest in young innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.